No, first I would like to ask your permission to use this video for educational purpose on the
that's
internet.
fine.
We were just laughing about because we were talking about your haircut.
Hair.
Yeah. Usually people after 3-level scoliosis surgery, what you got yesterday, don't feel like talking about their
Oh, really?
haircut.
Oh, I can
No.
hardly wait to get to the shop and get it cut.
Yeah.
I didn't want to do it beforehand because
Yeah.
didn't want to get COVID.
Yeah, you know what the people a day after this kind of surgery, after old-fashioned surgery, they talk and think about how can I just not have this horrible pain?
Uh-huh.
Because every time they move even a little, that
Even
sort of
with drugs?
even with drugs
Really?
sometimes, yeah, it can
No,
be very painful.
I don't feel any of that. I just
So
feel
how
an
bad is your
ache.
pain? How bad is your pain right now?
Pardon me?
How bad is your pain right now?
Oh, I maybe 3.
3?
And that's just an ache. It's
Yeah.
it's not stabbing
Yeah,
pain.
yeah. You had pain going down the leg for years,
All the way
right?
from the hip and sometimes in the groin and all the way from the hip joint to the ankle.
How long did you have it?
2 years.
2 years. 1 to 10, how bad was that pain?
Some days I couldn't walk.
Mm-hmm. And
It was serious.
how bad is it now?
It's good now. I don't feel it now.
You don't have it now.
Not in the
so
leg.
this is the best.
The only thing I feel is right in the small of my back, a little ache.
And I put like a dozen of big screws in your back
Oh, really?
yesterday in a surgery that. My part of the surgery actually was under 1 hour. A big
Wow.
scoliosis surgery under 1 hour, and we barely lost 2 ounces of blood. So the surgery went really well, and you're just 1 day out of surgery. You're not like a
Yeah.
week out of surgery.
Yeah.
And I understand that they're going to come and walk you today.
Yeah.
And how do you feel overall? You feel ready to walk?
I feel fantastic.
Excellent.
Well, I've been up on the side of the bed already.
Mhm, okay.
And that I was a little bit shaky. They had a walker that I could lean on.
Mhm.
And I was a little bit shaky,
Hmm.
but didn't hurt.
Yeah,
I just
after
have
all,
to be careful not to fall.
absolutely. And they will help you some tricks,
Yeah,
to do that.
good.
Now, vast majority of my patients after this surgery, as a matter of fact, 96% of them walk within the first day and they go home.
Well, that's good. That's
And
wonderful.
Well, whereas after open old-fashioned surgery, very, very did people
Long
are able to
rehab.
walk even after first few
Yeah,
days.
I didn't want that long a rehab.
Yeah. Now, what you did see another surgeon, and they wanted to do old-fashioned
Yeah,
surgery. What
yeah.
made you decide to do the minimally invasive versus old-fashioned surgery?
Because of the rehab, it
Yeah.
seems to be much less invasive and a good time for rehab.
Yeah,
Not a long,
Yeah.
not 6 months. Like
Mhm.
I know people that have had regular spine surgery.
What do you know about them? Tell me.
Well,
about
I know that they have about a 5-hour surgery and
Mhm.
that afterward they got about a 6-month recovery and they're not necessarily well then.
Now, have you talked to any of the patient, or have you watched any
One of
testimonials?
them died.
From
Well,
open
but she
surgery.
fell,
Yeah.
But
From open surgery.
yes.
Yeah. Yeah.
no, she had minimally invasive, but she
Mhm.
had it done at the University of Minnesota. I don't know who did it.
Doesn't that? Yeah, that doesn't. Usually, the bad thing happen very rarely. Not impossible,
I
but
think it was
much
just
less.
time for her to go.
Yeah.
She was way older than I am.
Yeah. Well,
I'm old now,
sorry to hear
but-
that. No, you're not. How
Oh,
old
God.
are you?
I didn't plan to live past 21, and here I am going to be 83 in November.
Oh, you're a good 83. No, our goal is to keep you independent.
I said my dad lived to be 89. I intend to catch up with him.
In average, you have, I think, another 15, 20 years to go.
I hope so.
Yeah.
I got a lot of gardening to do.
And that is our goal, to keep you independent. Enjoying your life.
Mhm.
And I think we have a good track to do that.
And my son is busily looking for a place to move
Mm-hmm.
out quite a ways where
So
it's woodsy and he
you're
wants,
already planning your.
yeah, he wants an acreage and he said I
Mhm.
just have to find the right house on
Mhm.
that acreage so that I can take you there.
Yeah.
He intends for me to move
You,
with
s-
him.
you see what we are talking about? We are not talking about how we manage your horrible pain and
No.
how we get you on your feet, because those problems we solved.
Yeah.
We are talking about the next 10, 15 years,
Yeah.
about how to keep you independent, how to
Sounds
keep you
good.
garden. These are good conversations.
Sounds very good.
These are not conversations that you usually have with somebody with after open old-fashioned surgery.
Mhm.
And that makes me really happy that I can, keep you on your feet.
Yeah.
Yeah. Well,
Yeah.
Otherwise, any question, any comment?
Well, I don't think so. I'm just very impressed.
Excellent. Well,
And I would hope that it stays that way. I don't know.
it will.
I think so.
You just have to be careful, though. Okay?
Well, and I have to be positive.
Yes, exactly.
Yeah.
Well, thank you so much for the interview.